Gentlemen, we have come to the highlight of today's evening. Let me welcome Ms. Sajeewana Amarasinghe to introduce our guest speaker today.
Good evening, everybody. Mr. Sajeewana, President and President of TCKOPA Norelia branch and his dedicated committee. Our guest speaker, Dr. Sajeewana Amarasinghe, office bearers and ex-co members of Trinity College Old Boys Association, fellow old boys, gentlemen, a very warm welcome to all of you. And it is with great pride and pleasure that I stand before you as the President of Trinity College Old Boys Association to welcome you to this evening, very important evening talk on mental health and well-being in a changing world, VUCA world. So I'm not going to explain the word VUCA, it will be done by the guest speaker himself. And first and foremost, I wish to extend our deepest gratitude to our patron, Father Andre Jaisundar, though not present here today, whose spiritual guidance and unwavering support continue to illuminate our path. And a very special word of appreciation to Mr. Ravindra, the branch president of Norelia, and his dedicated team for hosting this evening's event. And your dedication to organizing this gathering demonstrates the true spirit of fellowship and service that defines Trinity Brotherhood. The choice of today's topic reflects both vision and social responsibility, qualities that make our association truly meaningful. And we live in what experts say in a VUCA world, that is one characterized by volatility, uncertainty, complexity, and ambiguity. In such terms, the mental health is no longer a peripheral concern, but a central pillar and the central pillar of human well-being. The pressures of modern life, the rapid change of space, and the challenges posed by an ever evolving global landscape have all made it imperative that we understand, acknowledge, and address mental health, and with the seriousness it deserves. Tonight we are privileged to hear from Dr. Sajeewana Amarasinghe, consultant psychiatrist at the National Institute of Mental Health and the immediate past president of the Sri Lanka College of Psychiatrists. And Dr. Amarasinghe brings with him not only impressive academic credentials in areas from Peradenian, MD in Psychiatry from Colombo, and fellowship from the Sri Lanka College of Psychiatrists, but also a wealth of clinical experience and compassionate insight into the human mind. Doctor, your willingness to share your expertise with us this evening is deeply appreciated, and we look forward to gaining valuable perspectives from your presentation. As old boys of Trinity, we carry forward a legacy of excellence, integrity, and service. Tonight's discussion reminds us that true strength lies not just in achievement, but in understanding ourselves and supporting one another through life's challenges. Let us use this opportunity to learn, to reflect, and to become ambassadors of mental health awareness in our families, workplaces, and communities. I encourage everyone to engage in the presentation and also ask questions and to take away insights that can make a real difference in your life as well as lives of those around you. Once again, thank you very much for coming here. Let us make this meeting an enlightening and transformative one. May the Trinity Spirit continue to guide us in all our endeavors. Thank you. Let's begin the meeting. Over to you, Doctor.
Use that then. I might have to use that as well. Okay. Okay. It's not working. Right. Okay. Okay. Good evening, and first of all, I'd like to thank the president of the parent body, Aselan Arampanavar, and the Norelia branch for inviting me. Asela, and I go back a long way. When I was a student, Mahesh might remember when I was a student in grade 5, I think we had a few old boys who came to staff, and I think Nalin Vikramanayaka was in Carter Blues, and I think Asela was also there, but he did not teach me directly, but I can remember him. He was also teaching at Trinity. So although he looks younger than us, I've given away his age. So, and it gives me great pleasure to be here at the Norelia branch at this historic Radha grounds, home of the Dimbulla Cricket and Athletic Club, the oldest sports club outside of Colombo. I also have a tinge of sadness because I remember my very good friend and classmate, Prasanna Palyavadana, who was from Norelia and was a live wire of the Norelia branch. And whenever we come to Norelia, we used to meet him. And I think his untimely death left a huge void. And at this moment, I remember Prasanna and on behalf of all my classmates. So with that, we go to our topic, mental health and well-being in a changing world. Or Asela says vuca world. Vuca is not a very familiar term even for me, but I think it's a term used in management. I'll come to it. But anyway, the modern, and I'm going to do it in 3 parts, the lecture. Stress and anxiety. Second one, I'm going to talk about depression in men. And the third one, for the people like me and some of us here, about healthy aging. Maybe not for the youngest people, but aging healthily. So I'll try to do it in about 45 minutes and 50 and not keep you waiting too long. So this I will do in a kind of 3 practical case scenarios before we go to the theory. So the first case is a 33-year-old manager of a lead. These are all fictional cases. Of a leading accounting company was admitted with chest pain, palpitations, and difficulty in breathing to a private hospital in Colombo. All his investigations were normal and he was discharged on the same day. He had 3 civil admissions over the last month. Every time the investigations were normal. He's a father of 2 young children and is studying for his SEMA finals in addition to his work, and has reported increased work pressure due to difficulties in meeting targets. What do you think is happening here? Any idea? Yeah, stress. And I think where stress has gone beyond normal levels and it has gone to anxiety disorder. I'll come to that. And this is the normal life of a young professional today in that world, where you study, you work, even medical professionals, I think, Malinda would know, medical professionals in their mid-30s, they do exams, they have to do work, they have to look after children. It's no different anymore in the commercial world, isn't it? You are studying for exams, looking after families, and working, reaching targets. So we are living in a very difficult world. We'll come to that case later. What is stress? Stress is a normal physical and psychological response to events, whatever events that make you feel disturbed or upset, your balance in some way. So that is what is stress. Is stress always bad? Stress is part of our daily lives. Stress is needed to accomplish certain tasks like studying for exams. Without stress, our bodies would not react to danger. I'm sure you would remember the boys in our school who were not, who had no stress at all. They didn't care at all, isn't it? If you had no stress, because of stress, people came on time to school. Because of stress, they studied for examinations. It was because of stress. There were a few, of course, who had no stress at all, who just lived life in the backbenches. Some of them are doing very well, isn't it? Some of them are doing very well in life. So, but they are fortunate people, but most of us have stress. And stress is actually certain level good. And you may have come across this term, the Yerkes-Dodson law, the stress performance curve. So stress level is on this axis, this axis, the vertical axis, the performance. You can say when there is no stress, you have no activity. Zero stress is zero activity. So those are the laid back guys, who have no stress, you just have a good time. Then, of course, when the stress goes up to an optimum level, you start working and performing. Certain amount of stress is needed. But when the stress becomes overloaded, your performance starts coming down, right? Exhaustion comes in, fatigue comes in, burnout, and it is really the red zone. That case I was about, the case I was studying, then you read that red zone, anxiety, panic, you break down. So this is the stress curve. So stress is a necessity part of life. Some doctors, they said avoid stress. But how do you avoid stress? You can't avoid stress. Stress is always part of our life. Certain stresses can be avoided. We can come to that. So we always didn't live in this complex vuca world. We were born to a very ancient world. Ancient human beings, our body, was adapted to a world where we lived in caves. And what were the stressors during that time? Stressors were hunting and gathering. And our main threats were not exams or traffic or deadlines. Our threats were tigers or leopards or whoever animals that were there. So this human body is geared for that environment. Right? The body hasn't changed, although the environment has changed. Right? So you need adrenaline pumping. You're stressed, right? The adrenaline, the stress hormone starts pumping. Your heart starts beating. You get more oxygen to your limbs. You start breathing fast, get more oxygen again, right? Your muscles become tense. either to fight or to fly, right? Of course, we did that as schoolboys. It's also always part of school life, right? So sometimes we fight, sometimes we fly, but that was the main thing during the ancient times, right? So unfortunately, we live in a complex world. This ancient stress response is a hindrance in the modern world that was designed for physical threats, right? What are the now the same? What are the threats we have? Nasty emails from office, traffic deadlines, right? Traffic deadlines, unnecessary adrenaline is being pumped, and we are getting all stressed out, right? And what about these primitive reactions? Those days we had to either fight or run, right? And now the fights are leading to conflict and irritability in the office and home. And the flight is avoidance. Little bit of avoidance is good, I'll tell you later. And procrastination. Some people say they delay things, because of anxiety, they delay and delay and delay. That's, they delay, they avoid. Freeze is indecision and passivity. So these primitive reactions, not at all relevant to the corporate world. May come useful in plant, I don't know, may be coming useful in rugby, or it might come useful in rugby or things like that, but definitely not to the corporate world. The stress this is for a short-term system, short bursts of resource. But now their problems are long-term. So there's chronic stress leading to a lot of problems. We'll talk about it later. And the stress response narrows your focus to the fight or the leopard or the hunt or whatever it is. It very narrows your focus. What happens in the corporate world or in the working environment, that will shut down creativity and your problem solving skills, because you're just focused on your stress, right? So that's not again not good. So modern life constantly triggers stress, noise, workload. So we are in a constant state of arousal. And for many of us, there is no physical outlet for these stress hormones are gearing our body to run, right? But there's no physical outlet. Of course, some of you all are lucky in that way. You have these beautiful grounds you can run and play a bit of rugby in the evening. But many of us in the corporate world, the professional life, don't have any outlet. And that's that's the importance of physical exercise. I'll come to that. So this ancient survival system is poorly matched to the modern psychological and social pressures, creating chronic stress and reduced well-being. So that is the psychological principle, the physiological principle behind this. And now we come to this concept of vuca. VUCA, of course, means volatility, rapid and unpredictable change. Now, uncertainty, unclarity of the future. We are little fortunate in the medical profession, but we are still quite safe. But with AI and internet and AI, I think many jobs are getting replaced and jobs are getting changed. And I think even in the medical profession, the psychiatrist would be one of the last to go. It could be difficult for AI to maybe a little difficult for AI to replace psychiatrists. Definitely dermatologists, these people who scan, the radiologists and all that. I think orthopedic surgeons, yeah, you're also relatively safe. I don't know, the robots can also relatively safe. So there is huge job losses in the world, isn't it? The world is changing fast. And some jobs are becoming, some professions are becoming. I have a patient, he was a famous documentary maker for Rupavahini. Not a Trinity, a rugby player also. He came to me with depression. He has no longer, he used to make documentaries for TV channels. No longer, his job is no longer, now people used to do this with phones, right? So this, this traditional cameraman, there's nothing to do in the world, right? Of course, we know how Nokia went out of business, isn't it? So corporates and things are going out, and more and more complexity. The world is becoming more complex. World is becoming interconnected. We have our own cultures. We have our own traditions and cultures. But now our children, they get influences from everywhere. YouTube, they're not influenced by the parents or the school, by YouTube influences. They're influenced by all kinds of people. Their friends are, sometimes are the young people who are playing games. After the parents have taken away my phone, I can't play any, I lost all my friends. My friends are in the friends are all online. They have a friend from Denmark and somebody from there, they're all playing the games. So all social interactions are through internet and games. So things are very different. And there are no clear answers or precedents. So this has made the world a very difficult world. And of course, I have already covered this slide, the modern world, full of stresses, hassles, deadlines, frustration, demands, work problems, children and family, economic shutdown, the financial issues. Certain professions are badly hit, tourism, and I know when I asked the job, I know those days in the COVID days, people come and say, doctor, I was in tourism, then I know what has happened, tourism, now it has picked up, right? So relationship issues, and that has also multiplied. In Sri Lanka, we try. There are with these phones and these all connectivity, relationships have become very common. People have multiple relationships and conflicts, and all that has also become. It's very easy for, not like in our days to start relationships. You have to send letters or call land phones. People easily can start relationships, right? Missed calls lead to missed calls lead to relationships. So problems have increased. And young professionals like you all, it's going to be very difficult to balance your work, life, and family. It's a challenge. Of course, somebody will say, some of us, we are okay. Of course, each individual responds in a different way. Our thresholds are different. Some may face a lot of stresses. Some may fall. That is why we should not judge other people. They will say, my God, what is this? People will say, these are these minor things. Why are you upset over this? Different people have different thresholds, right? Somebody, the girlfriend, you have a small breakup, they might go into a depression. That is depending on their personality, their childhood experience, and their parents. But that there's a certain level where anybody can get stressed and depressed at a certain threshold, right? So our resilience is different. Part of our personality, partly genetics, partly our education. In that we have been fortunate that we need to have got most of us have got a good all-round education. I don't know whether where you have exposed to multiple societies, clubs, and sports, and that is the only way to build resilience, right? So Trinity, that is one advantage of the Trinity education, where we give an all-round education. So, what are the symptoms of anxiety? Now, when the stress becomes you have anxiety disorders, and what are the symptoms? Most of the symptoms are physical, and that's why people don't recognize it. These, as I said, rapid heartbeat, chest tightness, and people get fears about heart attacks, feeling faintings, shortness of breath, fast breathing, feeling of chokiness, trembling, shaking, and this muscle tension. There are lots of people who continue to come with aches and pains, headaches and body aches, but can't find anything wrong. So what happens is stress, the muscles become tense. And the characteristic tension headache is in the headache around you get the headache like this, right? Or your body aches. Of course, some people have the insight, they know they can connect the two together. I had a bit of a problem, so I'm having a headache today. But most people are unable to do that. And they panic. And of course, gastrointestinal, that's very common. These people sometimes say we have gastric, they have sent to several gastroenterologists, several endoscopies done. They might find something tiny wrong. Something tiny might be there, but nothing significant. And sweating, dizziness. So there are increased micturition, very common when you're stressed out. I think when you're close to exams, everybody goes to the toilet. So this increased urge to urinate is very common. So many of these patients go to general doctors, IC, OPDs, emergencies, and of course there are the younger generation of doctors who pick it up. But even if you pick it up, a lot of people don't accept it. They keep doing, keep spending their money. I'm not saying come to, see, when if you get heart attack, chest palpitation, I'm not saying you're going to attribute it to stress. You need to get yourself checked out. You need to get yourself checked out, and once you get yourself checked out, once and investigations are normal, then perhaps you might have to think whether it's a psychological thing, right? And so this is something that is missed in our society, and a lot of people waste a lot of money going behind the physical issues. What are the psychological symptoms? Excessive worry, persistent, uncontrollable worrying about everyday situations. Some people, what I call generalized answer, they worry about everything. I'm sure I've come across those people. They worry about the dollar, they worry about the politics, they worry about what's happening, what Trump is doing, always worrying, right? If the son is 5 minutes late, they think the worst thing has happened. So that is the way they are thinking. They're all catastrophic thinking. They're worrying about everything. Fear and apprehension, always on the edge, always on the edge, worried that something will happen. And difficulty in concentration and poor memory. So a lot of young people come and tell me, young students, university students, executives come and say me, doctor, I can't remember, I can't study, my memory is gone. Do you get dementia at that age? Do you get memory disorders? Almost impossible, very rare. So what happens is when you are stressed up, your attention span is poor. When your attention span is poor, things don't get retained in your brain. You don't retain it. You don't register it. When you don't register it, you can't retain it. So that's what poor memory, poor concentration, to forget things, make mistakes in the office. Very common in the banks and all that. People, they make mistakes and they get into real trouble. Then feeling restless, cannot be in one place. They'll just move themselves, just move up and down, feeling always keyed up and correct. And irritability, easily frustrated and short-tempered. And that's very common. They suddenly start getting into fights with their customers, their co-workers, family members, very short-tempered. So these are some of the red flags that you need to keep an eye on in your colleagues to find out if somebody is. So catastrophic thinking, I told that. Hypervigilance, I told, where you're always on the edge, feeling overwhelmed, fatigue, constant worrying, inability to sleep, right? And usually when you're stressed, you can't sleep. You can't sleep. You just keep in bed. And you look at the phone sometimes. Sometimes children, you just keep on looking at the phone. Sometimes parents come and say children are always addicted to the phone, always on the phone, right? Sometimes the primary problem is not the phone. The problem is the stress sometimes, because they are stressed, they just scrolling down. Even adults do that. Those days it used to be just sit in front of the TV and just watch it. But now scrolling aimlessly, again, when you're stressed. Eating too much or eating too little. Sometimes it could be some people, they sleep a lot when they are stressed. Sleeping too much or too little, withdrawing from company, delaying things, procrastinating, neglecting responsibilities, increased alcohol and smoking, substance abuse. So these are some of the things that we will see behavioral changes. And anxiety, about 350 or 400 million people in the world get anxious, have anxiety. A very common thing. And can be easily treated. So mild anxiety, there are psychological treatments. Sometimes it's just problem solving, try to assess the problem and understand the problem. Relaxation exercises, mindfulness-based therapies, I'll come to some of those later. And very important, physical exercise. Physical exercise is not just good for the body. Physical exercise can come handy for your mental health, right? Because it releases certain chemicals like serotonin, which makes you relax. So you go for a walk in the morning for 1 hour and see, or a aerobic exercise. You'll feel calmer. Of course, there are severe anxiety. You can take medications, and there are safe medications. A lot of people have worries, but I'm not going to go into detail. But definitely, there are safe medications which can be given for about a few months and can get over your anxiety. What happens in chronic stress? So one of the reasons Asylum wanted to solve this, the effect of chronic stress on old boys. We see young old boys, not only Trinitians, young people in Sri Lanka dying at very young ages of heart attacks and strokes. Anyway, we South Asians are somewhat, Sri Lankans and other South Asians are somewhat predisposed genetically to heart disease. We tend to get heart disease earlier. But chronic stress can lead to high blood pressure, heart attacks or myocardial infarction, strokes, gastritis, diabetes, muscle tension, and even skin diseases. So you can get a plethora of diseases where stress contributes to it. And of course, irregular menstruation in women, erectile dysfunction in men, reduced libido, all leading to very much family issues, migraine, poor sleep, some of this I've told. How do we cope with stress? People cope with stress in different ways. Some adaptive, some maladaptive. Let's look at the maladaptive coping methods, right? In Sri Lanka, in males, common is alcohol and substance abuse. Excessive alcohol use, excessive smoking. There's no excessive smoking. Smoking is bad. Even one cigarette is bad. Alcohol, it's a debatable thing. UK people talk about, cardiologists talk about safe limits, 14 limits, safe limits. The WHO has now come out and said don't zero alcohol, but they are looking at the cancer risk. But I will let it go. I won't want to spoil their evening too much. So let's put it at safe drinking, right? Overeating and undereating. So some people, what's called comfort eating. They eat junk food. You realize your children, young people do that. When they're stressed up and they keep on eating junk, they overeat. Some people stop eating, reduce eating. And in our setup, Sri Lankan males and Sri Lankans, both males and females, aggression and anger is a very, very common feature, right? Aggression and anger leading to family conflicts, leading to conflicts in the job. And a lot of people don't realize it's a psychological problem. And reckless driving. Road rage is very common in Sri Lanka. And as a very somewhat slow driver, I have been always at the receiving end. I always think that, okay, they are not well and I forgive them. So road rage, if you are shouting at, sometimes now people, sometimes the wife brings the husband, not that he is shouting at people on the road, there's something wrong with him. If you are shouting at people on the road, then there's something wrong with you. I know driving in Sri Lankan road is frustrating, but if you resort to that kind of behavior, there's something wrong with you. Anxiety levels are wrong. And excessive screen use, I told that. Excessive screen use in Sri Lanka. Children, adolescents. Self-harm, very common in Sri Lanka, maybe among the younger people. And self-harm behavior is more common among the females and the younger people. I will tell you what's common in males is more dangerous, right? And prolonged avoidance. Now, little bit of avoidance is good. If you have a problem with your boss, maybe take a couple of days off, let things cool off and come back. But if you don't come to work, they come and take a medical and don't come to work for 2 weeks or 3 weeks, then, you're going to be in real more trouble, right? Work is piling up, more stress. And denial and minimization. That is again, I'll come to that when we talk about depression. We males are very, very reluctant to accept problems. That's the way we have been brought up to it. We'll come to that. I'm going to come to that later. So these are just the principles. Recognize the sources of stress. That is very important. Recognize what the stress is. A lot of people, half the battle is won if you recognize that. A lot of people don't recognize it. And you have only two things: to change the situation can either, some of the stresses we might be able to avoid the stress. If driving is stressful, you can drive early morning, right? Avoid the traffic. Or you can alter the stressor. You can be a little assertive. You may change the job, possible. Or change your reaction. Otherwise, you might have some of the stressors we can't change. So you might have to adapt to the stressor or accept the stressor. I'm not going to go into details because I'm sure as an adult, you know examples and what I'm going to do. So adaptive methods, identify the problem, plan and prioritize tasks, seek information on practical help, talk to someone you trust. Just talking to someone is sometimes helpful. Just bottling it up, and we men are very good at bottling it up. Just telling somebody the problem doesn't need to be a consultant or a doctor. So when I have a problem, I may not look at it in a rational manner. But somebody, my friend might look at it and say, okay, now they might look, man looking from outside can see something we don't see. The perception, right? But the person in the problem doesn't realize, see all the options. So telling somebody, writing about your problems, and positive reframing. Sometimes we can reframe the problem. Your wife might be nagging you all the time. So instead of thinking she's a real headache, you can always think my wife really loves me a lot and she cares about me. And that is why she is always saying like this. So let's reframe the problem. So there is another principle you can use. And so these are the things to do. Regular physical exercise. Even though you are a busy professional, try to get some regular exercise. Half an hour a day for 5 days a week, at least. Healthy sleep routine, balanced nutrition. I'll come to that later. Limiting sleep time, this deep breathing and all that. I'll do that if I have time, right? I'll do that at the end if I have time. Engage in hobbies, reach out to friends and family. So this is why these old boys associations and all are very useful. And for the older people, elders association, old boy clubs, these things are very useful. So you meet friends and network, join support groups, but always remember to seek professional help if things don't improve. That's the case that I told you. That was a case where, when things are really gone bad, don't hesitate to go to a professional, right? I'll come to this later, especially if there's time, we'll see how things go. And go to my next one. And I've titled Depression in Men. Because men, why I say depression in men, of course we have a few old girls. Apologies if anybody is listening, but I think a 45-year-old male presented increased alcohol consumption over the last few months. He also reports he has become irritable and loses his temper with family and friends. He's a senior executive in a private firm and has been under increased work stress. So, what has happened here? He's a guy who was a social drinker, now drinks every day, gets angry, and let's say he's not going to work also. His work performance has also come down. Bosses have complained. I put more in. And his personal appearance is also not very good, right? And, he's always moody. What could have happened to him? Huh? Yeah, it's what we call clinically a depression, isn't it? He may be having clinical depression. So depression, classically, to feel unhappy persistently. We all have our ups and downs in life. We have our good days and our bad days. But we will pick up always. We meet a friend, we pick up. That is not depression. Depression is when you feel down throughout the day for weeks, maybe for 2 weeks, 3 weeks. Things look dark, things look low. You lose your pleasure in the usual pleasurable activities. You lose your interest in your usual hobbies and activities. If you like to watch cricket, now you watch it, but it doesn't really gain any pleasure from it. Work is no, it becomes a real headache. You become angry and irritable. Your concentration goes down, your forgetfulness down. Your self-confidence goes down. You feel that you're a burden to everybody. And you start having negative thoughts about yourself, past and present. More and more negative thinking, guilty about minor things. And then sometimes you feel hopeless and helpless. And there might be a time when you might think, it's good if I die. You have that feeling. If something happens and I die, it's better. I'm better off dead. And then, of course, you might come to a situation where you decide to end things, right? Actually, might have suicidal. So depression can end in tragedy. Disturbed sleep. Usually in depression, in stress, you get difficulty in sleeping. In depression, you wake up in the middle of the night or early morning, roll up and down in the bed, feeling low. You might lose your appetite, you must lose weight, and lose your sex drive. It can also present in different ways with multiple body aches, headaches. So people are very unlikely to tell sometimes physical. Sometimes the prominent things might be the body aches and the physical sensations. Unfortunately, many families don't recognize depression. And even if referred after the diagnosis, patients don't go for treatment. They think the person is, he's lazy. You need to pull yourself together. That's what they say. Pull yourself together and do something. But they're ill. And the treatment might become worse, side effects, they're worried. And they're worried about being drugs on lifelong and fear of addiction, which are all unfounded fears. So why do some people become depressed and some don't become depressed? It's again to do with our resilience, genes and environment, right? Some might susceptible, it is genetic susceptibility and environmental triggers. It's a very common psychiatric illness. 20% of people get depression. Again, around 350, 400 million of people in the world will get depression sometime in their lives. So, and if you look at the statistics, they say females outnumber males by 2 to 1. But is this really true? Let us look at the suicide statistics. It is very frightening. In Sri Lanka, men commit suicides 5 times more than women. Men rate is 27 per 100,000, women's rate is 5 per 100,000. If you look at the overall world statistics, men are 2 times more likely than females. Our overall suicide statistics have improved. I always tell in the 1996, we were number 1 in suicide and we were number 1 in cricket, right? Now we have gone down in both. So cricket going down is not so good, but suicide we have gone to about number 20, 21, which is a good thing. But I don't have to explain all how it happened, right? So, but still things are not so good. We have about rate of 15. We have about 3,400 suicides per year. 8 per day. You read only about these famous 1 or 2 cases that are reported in the newspaper. And out of them, 83% are men. Remember that, 83%. Nobody talks about this. Why is depression underdiagnosed? So depression is there, it is not diagnosed. The masculine gender norms discourage help seeking. Especially in public schools like ours, we are taught to be strong. You're men. Don't talk about emotions. Don't be a crybaby. Don't be a sissy, isn't it? And they believe that depression is a sign of weakness. There are some people who believe that men are even incapable of telling these emotions, right? Men, that's a bit controversial. Some feel that it's generally, I feel that men don't want to tell it, right? And doctors also miss depression in men because it's masked by alcohol and substance. Mainly it's alcohol or substance or thing. And depression is underneath. Anger and irritability and physical problems. Men don't come and say, doctor, I'm down. I mean, they do in the Western sometimes, but mostly no. They think that's not good to your self-esteem. So how do you identify depression in your colleagues? irritability, short temper, road rage, fatigue, headache, body aches without medical causes, gastritis, so-called gastritis coming over and over again, no cure. Loss of pleasure, no longer coming to the gym, no longer coming for your sports or your meetings, and the escapist behaviors, drinking heavily. Some people overwork, some people just overwork heavily, and gambling, reckless driving, withdrawing from your friends, social withdrawal, withdrawing from your friends, and reduce work performance. So these are some of the ways you can identify. And always look for the statements. Female, some are very common, especially I don't want to do how sexist, but sometimes they say, Mama Marino, Mama Marino. Some people always say Mama Marino, right? So male don't generally tell like that. They don't do that also, but they will always tell. Men will not tell like that. Men will tell it in a very subtle manner. They might say, you'll be all right from next month. I won't be around. You will no longer have my burden. Or there is no way out. They will tell it in a very subtle way. And sometimes nobody will pick it up. Nobody will pick it up. And suddenly, when you are suicidal, you are in ambivalent. Whether you feel that there's no point in living, but also you think of your family, your children, and you are in a bit of an ambivalent state, and you are very disturbed. But when you make up your mind, you might become very calm. You might become very calm, and people can't understand why he committed suicide. Once a decision is made, they might become very calm. And one another reason is men are more likely to use violent and lethal methods. You know the method, but we generally don't talk too much about methods. Of course, if there's nothing else, there's a national mental health hotline, 1926, manned by trained nurses 24/7. There are other hotlines also. This is the better hotline because it's manned by nurses, goes up to doctors, but sometimes can be difficult to get into. That's the problem. There can be difficulties in accessing. But there are several hotlines. Depression, mark my word, depression is a highly treatable condition. And with the right support, most people make a very strong recovery. You don't have to treat you for whole life. Sometimes you have one depressive episode in your life. You might go through a divorce and you get depressed, to get treatment, and that's it. Right? Very rare. So you may have one depressive episode in your life during a bad time. There are safe medications available. These are not addictive, and there are modern medications. And first episode of depression treatment is needed only for 6 months. If you keep on getting, then of course you might need to treat for 2 years, 5 years. But the majority of the people you can treat in 6 months. A lot of people ask, can you do psychotherapy? Well, mild, if the depression is very mild, yes, definitely we can only do psychotherapy. Unfortunately, in Sri Lanka, qualified psychologists are difficult to find. And many of these so-called counselors have little qualifications, so you need to be careful and hope to go. When the depression is severe, you may have to go only with medications. When it is somewhere moderate, you can try both. So you might see a psychiatrist or a qualified clinical psychologist might help you decide which way to go. And as with anxiety, regular physical exercise is known to increase serotonin levels and help you with depression. It's not going beyond it, no? Sorry, wrong one. Okay, now how many minutes have we gone? 40 minutes, isn't it? What time did we start? 45 minutes have gone. So in the last part of the talk, I will talk about healthy aging. That is for some of us, of course, the young people. But remember, you have to start in your 40s. These things have to start in your 40s. You can't start healthy aging techniques when you're 75 and partly demented, right? You have to start in your 40s. So just I just put accountant, 68-year-old accountant complained of recent memory loss. It's not you, it's a 68-year-old. He works part-time for his former company and finds it difficult to cope with work. I put plant and to change it. There is cope with work. His family reports he's frequently forgetting things. And this is very uncharacteristic. His long-term memory is normal. He can remember his everything past. And he's on treatment for high blood pressure, but remember, he's frequently physically fit. But, if you tell something, half an hour later, he might, the son calls and said, Dad, we are going to go to the doctors tomorrow. And again, evening, the dad might come, when are we going to the doctor? So he will just forget it. Little short-term things he will forget, right? He will forget the short-term things, long-term memory perfect. What is he having? Is it normal aging? Is it normal for a 68-year-old? Lot of people think this is normal aging. No. Normal aging, dementia, sometimes there will be people 95, 100 with complete normal. This is early dementia. So, I'll come to that. 57 million people in the world are living with dementia. And it's going to expected to rise to 78 million to 152 million. And Sri Lanka has one of the fastest growing elderly populations in Sri Lanka, right? In South Asia at least. So in 2014, 12% of the population over 65. By 2041, 1/4 will be over 25, over 65. So you might have to rethink about your giving higher interest rates to elders, right? Banks will go bankrupt. 25% will be over 65. So, and that is why dementia is increasing. People are living longer. Whatever people are saying, modern medicine has had its effects, Children, those days in the 40s and 50s, a lot of babies died. People died in their infancy, a lot of infections and childbirth. If you had a major infection, that was it, right? So we have treated all the infections. Now we are left with the non-communicable diseases, diabetes, cholesterol. But now, what of the young people are now aware of it? They're taking precautions. A lot of people are living productively to their 70s and 80s. Now the WHO defines 65 to 80 as young old, right? And elderly has been pushed to 80 and above, right? So this is a major problem in this country. So dementia is becoming very common. And also remember, our extended families are breaking down. Parents are now living alone. Most children are in Australia. I always tell parents they are very lucky if they have at least one son in Sri Lanka, one child in Sri Lanka. Most children, people in their 70s and 80s, almost the whole family is in Australia or Canada or US or New Zealand. So they are living alone. So they forget recent conversations or events, misplace items more frequently, repeating the same questions, and difficulty in learning new information. And they can't, they are impairment in daily functioning like banking, cooking, using appliances. Suddenly the husband might complain the wife is putting too much salt or not putting any salt, right? Putting salt 2 times or 3 times, right? And also they might come with mood changes in the elderly. Unfortunately, we still don't have a proper treatment for dementia. We don't have a proper cure for dementia. But there are medications that can help decline if you come early. A lot of people bring when they think this is normal age. Doctor, hondata matakai yaata, parana deval hondata matakai, wada karapu deval matakai. So they think this is normal. They present when the memory loss is very severe. When they start wandering about the village, getting lost, right? Suspecting. They think the servants are stealing, they forget things and they start fighting with the servants and the neighbors that they are stealing. And they are starting to get hallucinations, seeing people and things. That is when they bring, then it is too late. If you bring early, there are medications and therapies to prevent. and cognitive stimulation therapy. Although it's a big name, it's a simple things where you can train at home. Simple mental exercises done to prevent progression of dementia. Now available at Colombo and Kalugovid. So there are 14 risk factors for dementia. There are 14. Physical inactivity, and the second one is smoking and excessive alcohol consumption. So we have been little liberal, excessive alcohol consumption, air pollution, head injury and yeah. So that's where boxing and things like that, even rugby, boxing, head injuries, right? Helmet use come into play, right? Infrequent social contact. So a lot of people, social isolation is not good. Less education, obesity, hypertension, diabetes, depression, hearing impairment, and so this is something, and visual loss. This is something that you need to look into in your parents and grandparents. You see, I know it's very difficult, but make sure that it's very difficult to get them to wear these things. I know that, we must try to correct their hearing and vision. It's very important. Improves their quality of life. But of course, they will say, doctor, they don't keep it, they don't like it. But always try that. And high LDL cholesterol. So what can we do to prevent dementia? I think Asela was asking on the way. So yes. So these are the 14 risk factors. Start in your 40s. So these are the things. None of these are magic. There are no magic solutions. I know these WhatsApp groups, this thing happened, coconut oil causes dementia. Well proven virgin coconut oil, we have done it. One of my friends, Professor Shahan Williams, did a study in Sri Lanka. He was sponsored by the Coconut Development Board. The Coconut Development Board gave money to study whether virgin coconut oil prevents dementia. And the result was absolutely failure, right? So he was honest enough, it was absolute failure. So there are no gimmicks so far. There might be in the future, no gimmicks. So physical exercises, moderate exercise 5 days a week, walking, cycling, or swimming, right? Make it part of your life. And the healthy diet. And the best diets are, you need to be sustainable diets. Don't go for these fad diets of eating only fat or eating only eggs. And, you can't sustain those. And one of the best diets is the Mediterranean diet or the Mediterranean style diet. There's a similar diet called the DASH diet. You can look it up in the internet. A similar diet called the DASH diet. So fruits and vegetables, legumes, dal, whole grains, nuts and seeds, healthy fats, and moderate amounts of animal products, especially fish and seafood, poultry and eggs, and yogurt and cheese. Moderate amounts of. So fish, seafood, and chicken is generally considered, eggs are generally considered better than the red meat. And eat less. Red meat, try to eat less occasionally. Processed meats, try to avoid, like sausages and bacon. Limit coconut oil and butter and ghee. Minimize sweets and refined. We are not saying no. Modern dietitians, if you ask a clinical dietitian, they will never forbid anything. It's the amount and the frequency. You can't, in the long run, you can't do that. You can't have this, you can't eat only fats or only eggs, or that is not going to work in the long run. You might put down weight from sudden loss of weight for 10 in a month, but then you'll go back. Right? You need to find a sustainable one for you. 3 regular meals, but modified. Right? And or once in a while, eat the things that you like. And reduce intake of fast food, that's packaged snacks. And sleep 7 to 9, especially for older guys, right? Quality of sleep matters for memory and mood. And regular sleeping pattern and sleep hygiene. So those in their 50s and 60s who got 6 hours of sleep or less at a higher risk of dementia. So remember that. Try to get a good night's sleep. And quit smoking, right? There's no compromise on that. And relaxation, mindfulness, meditation, yoga. You don't need to do these things. You need to do what you like. might be rugby, it might be golf, it might be running, it might be, do some activities, it might be gardening, it might be, do things that are, keep yourself active. And this is the most important one, cognitive stimulation. Don't retire and do nothing, right? Keep your mind active, and that is very important. And new learning is supposed to be the best one. Learn new things. It could be a new game, a new language, a new art, music, cooking, whatever it is. Try to learn something new, especially when you are retired or close to retirement. When you are retired and doing nothing, try to learn something new. Doing the same thing. Now, for example, if you are an engineer or IT professional and you continue to do consulting, that is also okay. It's also okay. But you try to learn something new, you stimulate the brain more. You try to learn, you learn piano or you learn guitar or something like that, something new. Right? Reading and writing. Keep on reading and writing. Crossword and puzzles. If you come to the National Hospital Consultants launch, you will see all the consultants fighting to get the crossword because they all know, all the specialists, they all are doing the crosswords because that is a very good way of stimulating your brain, right? And board games and card games and things like that. So keep your brain stimulating. Don't let it go, right? No point. I know my friends who are father is 75, totally demented. It's no point getting him to do crosswords then, right? It has to be done early. And socialization. So that's why this is very important. Be socially active, join group activities, join clubs, join charity work, keep contact with friends and relatives. In fact, for elderly people, Facebook and WhatsApp is good actually. You keep in touch with all your friends, and I can see many of our former teachers, on WhatsApp, on Facebook. That is actually good. And some children stop that also. My mother is having 85-year-old mother is having always on Facebook. He has confiscated the phone and all that. He said, why mother is not doing any exams? So that is actually good. Keep in contact, right? So my mother is 83, very much active on Facebook, right? So which is actually helps them to keep in contact. But they might not be able to physically go and meet people anymore. And physical health. Control your blood pressure, keep your blood sugar and cholesterol levels under control, and correction of visual and hearing impairment. And before I stop, I think we come to about 1 hour. So I'm not going to talk to you, but I'm going to give you some resources because I don't think there's time to do. I'm not going to, make you do breathing exercises. Asela wants me to make you do breathing exercises and mindfulness. But I know better than to get a group of planters to do meditation on a Saturday evening. So I won't be doing that. But I'll give you some resources, Yeah. So nowadays, you get apps for everything. And I think especially we have a younger audience, there are so many internet apps. There's one called Calm, offers Headspace, very popular. Headspace. And these Smiling Mind, Mood Mission, Stop, Breathe and Think. And this Headspace is very popular. And these teach you mindfulness and meditation, right? And I will end you by telling you what is mindfulness. It's a big word. But it's nothing. It's being paying attention on purpose in the present moment, non-judgmentally. Be on this moment. That is simply being mindful, right? And be aware of your emotions. Be aware of your emotions. You must be, okay, I'm getting angry. I'm getting sad. Now, anger control, the basic of anger control is getting to know when some people, all of us get angry. Some act out, some don't act out. Because those who don't act out are able to pick the changes in their body and mind and get to know that they are getting angry. Okay, I'm getting angry now. I must move out of this place. Oh, I must stop. I must stop talking. Right? So that is mindfulness. To be aware of your emotions. That is a very important thing. So your body is at the present, But is your mind in the present? It might go in the past or it might be in the future. So, like simply mindfully sitting comfortably, bring attention to your body, notice the breath going in and out. The mind will wander. You will realize how many times your mind wandered during this 1 hour. Mind will wander, that is normal, but bring it back gently. Bring it back gently to attention. Nobody can be perfectly perfect. You just mind it wander, you bring it back without getting upset. Gently bring the attention back to your breath, your body or your breath. And notice sounds and sensations as they arise and disappear. So this needs great deal of practice. You can't just do it. If you practice, you need to practice this, and you can do it on your own. And body scanning, focus attention on various part of the body. Walking meditation, that's something that you can do. Just focus on your feet. Walking is good, but to get the real benefit, just no point walking while on your phone, or to get the psychological benefit, or in the phone, or you focus on your walking, feet, your breathing pattern, and other sensations. Then that is mindful walking. Even mindful eating, sit at the table, eat slowly, focus on eating and how you do chew and texture. In fact, slow eating is very good, isn't it? Slow eating is not only good it is a very healthy habit, because if you eat fast, you eat a lot. But if you eat slowly and mindfully, you know when you're satire, because you have to give time to your food to go to your body. The food has to enter your body, the bloodstream, and the message has to go to the brain. Now I'm full. Right? If you keep on putting things in, you end up putting too much in your body. Right? So these are some of the mindful techniques, and I've left a bit for the question and answer sessions. And so very much. Thank you very much for coming here on a Saturday evening from far away, and thank you very much for very mindful listening from all of you. And I'm happy to take any questions.
Question, doctor. How can we differentiate between normal stress and health condition that requires professional help?
Yeah. So that's what I told. Now that case I told you, one thing is the effect on functioning. You see, always, so in psychiatry, there can always be a spectrum between normal and abnormal. If your effect on functioning, if your performance is going down, if your relationship with your family is getting deteriorated, if you're having problems with your friends because of it. Now, children, teenagers, some of you may have teenagers, depression, anxiety, very difficult to pick up. Again, their signs are like irritability, not doing studies, withdrawing to their rooms, very difficult to pick up, right? But if their studies are coming down drastically, somebody is getting 80, suddenly start getting 60s, just give up on the extracurricular activities. So one of the first things is, if your functioning level is going impaired, then you need to think whether this is going beyond.
Another one, what strategies can help individuals manage information overload and digital fatigue?
Okay. So I think that's a bit of a tough one for me, but I mean, information overload is like, now this is the thing. Now there are some stresses we can avoid. Now, there are some stresses we can avoid. Now, if you are getting stressed, now during the COVID, we used to tell people used to get stressed, 5 has died today, 10 has died today, 20 has died today. So when we said, okay, limit this, something is stressing, limit your time, or maybe look at that only once a day, or 1 hour, leave just 1 hour for that, right? So leave 1 hour for that. If a certain topic is becoming very stressful, you avoid that topic, or at least minimize your thinking on the topic, right? So that is one thing. Same with people. If a certain person We need, if a certain person in the office is keep on annoying you, we need to say, okay, just, you might have to cut him off and say, okay, I don't want to talk with you anymore, right? Or if I don't want to talk with you anymore because you seem angry. When you are better, you come and talk with me when you're in a better mood. You may have to block people sometimes. So, internet and phone, if things are unhelpful, because I think phone and internet is part of our life now. Anything, we need that because all the information is there for work or leisure. But if it is stressing you out, then we need to limit it.
Last question. What emerging trends in mental health care should we expect in the next decade to address challenges in the vuca world?
Yeah, I think one way we are reaching out now is now, especially doctors, mental health digitally. So that's telemental health and digital mental health. So I told you now there are lots of no psychiatrists, of course. There are huge demand for psychiatrists in the Western world, which is becoming the same here. So we do a lot of maybe telemedicine and also basically the digital mental health. So where we have lot especially the Western world have given a lot of apps, and a lot of you all are fluent in English. You can use them for relaxation. So even there are apps which can test whether your depression or anxiety levels are normal or abnormal, and whether you need to see a doctor or not. So this, and also there are therapy. You can deliver therapy through internet, or therapy can be delivered through digital means, right? Because busy professionals, for example, if you take cognitive behavior therapy, you have to see 1 hour sessions weekly for 21 weeks, right? So that's very difficult. So online therapy, digital mental health, and maybe using AI also in certain situations. That is probably the trend that is going to happen. And also maybe when it comes to the corporate world, I think our corporates will have to adapt. I think there are certain multinational companies we have to look, we have to look at the mental health of our workers. It is not happening. Overworked. Nobody is worried about the mental health of our workers. There was a driver who told me, he quit his job with a leading bank. He was asked to come at 2 o'clock and drive for 10, 14, 16 hours. Nobody thinks about the mental side and here the physical risk. So companies will have to think about not only short term and the long term productivity, where they may have to have some kind of flexibility and working hours and an environment, and I think probably managers need to be educated on mental illness, mental health, how to pick up early signs of mental health, and to be more compassionate towards people with mental health. And I think some companies are already developing. And I think it should be essential to have at least a counselor, a trained counselor, if possible, a psychologist in the HR department who can refer to. And because every problem need not go to a psychiatrist, but you should have somebody who can screen it and send it upwards. And I think things are changing, but still people are scared, People are scared to see psychiatrists. People are scared to give medicals from us, thinking that you'll get stigmatized, right? People are scared. They will say, but if I give the medical, will my boss sack, will it affect my promotion? So you need to realize that mental health problems are common. If you are going to 20% are having mental health problems. So if you're going to sack all those, I said if they're going to sack all those with mental health problems, they will not have enough employees, right? So things are changing, but I think the corporates have to change more. And I think especially the people at the top management level need to be a little bit more sensitive to this issue of mental health.
Doctor, now still devices are also part of this area. So, are there any best practices in using devices so we can work in away from devices?
Well, under 16 don't give phones. Now, Australia has banned, England has banned. We have talked to the Prime Minister. She's still not very decision. Of course, it's difficult to implement. But they're going to ban under 12. If you give your phone to a 12-year-old, you can never take it back. Mark my words. If you give it, you can't take it back. And if you want to take it back, you'll have to probably, there'll be a huge outcry. So what I will tell you is invite your uncles and aunties and everybody, have about 10 people in the house and take the phone, because the fellow is going to really, really lash out, right? So under 16, don't give phones. At least make them use your phones. But our schools are sending to WhatsApp. That is very bad. So social media ban will give some power to parents. It is not implementable. But if your son, 15-year-old son asks for a phone, you can say, I can't give because it's banned. But now they say all the children have phones and I also need one. Right? So that is one thing. For adults, I think it's a good practice to stop looking at screens at a certain time in the night. But the new generation, maybe not y'all, the ones who are IT professionals, I don't know whether they are, these IT professionals who are working from home, what are their sleep hours now? These students who are having online classes, what is their sleep hours? They sleep around 3 o'clock and wake up around 12 o'clock. So parents come and tell, I tell you, this is like the norm. It's like the norm. It's not so I'm sure it's not so in planters or bankers, but this is the sleep hours. So they just keep on in the games for 2-3 years. And it's very difficult to get your sleep. They say they're sleeping. You have to be very careful, because it is not a matter of poor sleep. It is a completely changing the sleep rhythm. They wake up around 2 o'clock, right? And of course, some people can't help it, because either they are working for US firms and all that. So those people can't help it. IT professionals working for Canada or US, or then they can't help it. But so stop screens at a certain time. And if it is becoming a problem, so you may have to do things like maybe take Facebook out of your phone. Maybe you have to take Facebook out of your phone, right? And maybe so you have to use, this is just common sense strategy. There is no real, those with severe phone addiction, we might have detox them, especially children and teenagers. You have to admit them to hospital and take the phone out for 2 weeks, and then there's no other way to do it. But for adults, curfew at maybe at 10 o'clock, I'm going to switch off the phone, at least switch off the internet and keep it, right? At a certain amount of time. It's not good for your eyes, it's not good for your sleep. And also maybe a lot of people spend a lot of, and maybe not check Facebook in the morning. That's also, sometimes I miss my gym also, because if you look at the WhatsApp and all that, suddenly time has gone, no? So I think maybe have a set time, fixed time to check your Facebook. But now WhatsApp is part of work, no, it's very difficult. WhatsApp is part of work, WhatsApp groups and all, so it's all part of work. So it's very difficult. And I think for doctors, you can't switch off the phone if you're on call, isn't it? So it has become part and parcel of our lives. Everything we depend on it, chat, Google, information, everything comes from the phone now. So it is an essential part. But if it is becoming, you may have to set some limits to yourself. I don't see any other. We can't go back to these small phones, or you can't do that. Right? Okay.
But Dr. Now, you said below
16.
Below 16. But in Sri Lanka, the problem is where is the infant school?
Yeah, that is exactly. Yeah. They are addicted, because that is the easy way out. No, even doctors do it. You say the child is crying, you give the phone, and Now, what I said is ban social media under 16. No phones at all, at least until they are about 6 or 8. I mean, you can let them watch a little cartoon on the phone or the laptop for 1 hour. Banning is social media, actually, not the phone. The ban is for social media. But, you might allow them to watch them for education programs for a limited time. The Sri Lankan parents are very bad. The modern parents are very bad at limiting things, you see, parenting consists of not just of love and protection and love and giving everything. You have to set limits to your children. Yeah, it's done for convenience. Done for convenience. So that is disaster. If you give them phones, you'll never get. You can't. Once they're hooked on it, you can't take it out. They'll cry and you can't take it out. I mean, you can give them, okay, not for infants, maybe like 8-year-old or 10-year-old. Yeah. Maybe not a phone. We may give them a laptop and let them watch some cartoons on the laptop for an hour or two. Because once they get hooked onto it, you can't. There's no turning back. Okay.
When we were young, we never heard of this anxiety. Now, most of the kids, young kids or adults, they more of anxiety.
Yeah, we had anxiety, I think, but things were not so complex. I think we managed it. You see, things were not so crucial. No? So now the pressure is too much. Now the pressure is too. I can tell you two reasons. One is the pressure is too much. If you take rugby, take cricket or rugby, the pressure to win too much. I treat. I don't want to say not Trinity, but Colombo schools. I treat children, rugby players who get stressed. And more than the players, the mothers come. That is the biggest thing. Not the father, the mothers come and treat the mothers before the match. If the son gets injured, the mother gets depressed. So this pressure, even sports have become highly pressurized. A levels, everything has become highly pressurized. That is one thing. Second thing, with the COVID, you see, resilience is not something that can be taught or built or done in a one-day program. Resilience has to be built from childhood. And how do you build resilience? By facing problems, isn't it? By facing problems, going to school, doing mistakes, getting going, taking part in sports, clubs, facing frustrations. Now, parents protect everything. If the child doesn't do the homework, the mother will do the homework and send. The mother will if the child is getting punished, the mother will go and tell the teacher and somehow shape it up, right? So the we have, and now with the COVID, lot of online learning, no extracurricular activities. So there's a generation coming up which has no resilience. So if the best friend, they come and say, what has happened? No, I just saw on WhatsApp, my best friend has had a party and not invited me. So I'm feeling depressed and suicidal, right? So that is the resilience level you have now. So for that, I think it has to be a long-term change. Now we had a discussion with the government. They want something immediately. There's a survey, 20% of school children have depression. And I mean, don't put it in newspapers and all that. But 80 children committed suicide this year. 80 children in Sri Lanka. I did 80. The last 2 years, 80 children have committed suicide. So the government wants a sudden fix. There is no sudden fix. The only sudden fix we can give is maybe detect the children in the school and somehow treat them. So that is one reason these education reforms are coming. But it's very difficult to get things done in Sri Lanka, isn't it? There is this whole, that is why they are trying to do. I mean, trying to make these, now that is the modern world. The examinations are less stressful. Now, if your children are doing Edexcel, they will know. Edexcel, you can do the exam in 2 stretches. And if you miss a subject, if you don't have a grade, if you don't have an A, you can do do that particular subject and get an A. Sri Lankan A level is not like that. It's do or die, right? If you don't do it, you have to do it one more time. So So actually, Sri Lanka, Korea, Japan, we are very, very competitive. Suicides are high, right? So we need to change that. Yeah, there is a curriculum change proposed, but will they be able to push it through? That is the thing. It's good if they can push it through, right? So they are going to reduce exams, and that's going to be very good, because the first 5, at least up to grade 9, children should be able to, at least up to grade 9, they should be able to play and, enjoy school. From grade 9, 10, maybe O level and A level, the students can take studies, no? Now, when we were in the junior school, we took part in almost all the sports, but no longer the same, right? And the sports have also become stressful. That is, that I think there's no way out of it. Because a lot of money has come into it. In fact, I can only think of American high school football or college football in America, where inter-school sports has become so, if you've been to Australia, you will realize school sports is hardly anything. And I can tell Mr. Wilson told me he went to Australia and was asked to coach cricket practice on the lunch hour, 1 hour, right? They don't do badly in cricket, but they don't, at that level, they don't do it at that competitively. So, but we can't help it. That we'll have to compete. There's no other way. If Trinity doesn't compete, we'll be in the B division next year, right? So we can't help that. But at least the curriculum change is helpful. We hope it will be helpful, the curriculum change. But there is a lot of resistance to that, right? Okay. I think we are running out of time. No, is it any other? Okay.